Good evening. Welcome to the Hackney Scrutiny Commission. Councillor Adari and Councillor Billy Gordon are here this evening to give their apologies. First thing is to elect a new chair. Do you have any nominations for chair for this evening?
I propose Councillor Salmon.
Thank you. And second,
welcome everyone. So before we get started, I've just got some housekeeping stuff to let people know about the meeting. So this meeting is a hybrid meeting. You've got some people on the screen. It's being recorded and live streamed now. So well, I've got thinking about microphones, but not got microphones in here. But it'd be great if people could direct for the speaking for the microphone in the centre there, so that people online can hear what you're saying. If you'd like to speak, if you could raise your hand to get my attention, I will take note of that and have to bring you in. For people online, the chat function must not be used for conversations with other participants or to provide personal information. All of the chat is recorded as this is a formal meeting. If you do want to use the chat function, only use that to alert me that you wish to speak or to raise points of order or to report tech problems, with our very helpful officers who are online will do their best to help you. This is a formal meeting at Hackney Council, so we can have the council in attendance and the right to the council in public to record and film this meeting online. That's the end of housekeeping bit of the thing. Now to move on to apologies. So as is noted, we've had apologies from the chair, Councillor Adari, and the vice chair, Councillor Moran. We've also got apologies for lateness from Councillor Garbeck, who will be joining us later on. Can I just pause and check if there's any other apologies I would note? So the other thing I should also note is that I think we're going to be joining online, but haven't yet been joined online by Councillor Joseph as well, Councillor Joseph virtually as well. Any other apologies? Susan, sorry.
So, unfortunately, Dan Benjamin, he's got an emergency. He was meant to be presenting, she's got the family emergency. He's not going to be.
Thanks, and you could, I should have noticed that, right? Apologies, that was on my piece of paper in front of me. So thank you for keeping me right on that one. Any other apologies? No, great. So if we then move to item 2, which is whether there's any urgent items or order of business. So I'll pause there to see if there's any urgent items that people want to raise. Nope. And then in that case, moving to item 3, which is any declarations of interest. Are there any declarations of interest that members would like to declare? Thank you very much. In that case, we'll move to the main item that we've got today, which is on Validity Violence Against Women and Girls Strategy 2022-2025. I'd like to thank everybody who's come along. We have lots of expertise in the room, so I look forward to hearing from all of you. So just as background to this, as one of the strategic priorities of the Community Safety Partnership Plan, we're keen as a Commission to hear about the progress that's being made in delivering against the existing priorities and actions outlined in the current Eliminating Violence Against Women and Girls Strategy 2022-2025. But we're also aware that the discussion is timely, given that the refreshed strategy is due to be agreed in late this year, late 2025. So this feels a good opportunity for us as members to input into the emerging priorities and thinking about how they might be delivered at an early stage. As part of the scrutiny process, we recently held a focus group with third sector providers, especially support services, to hear about their views on the progress being made and what they would like to see happen going forward. I think we'll provide a brief report detailing what was discussed within the agenda papers. We have a number of attendees from statutory services, local authority teams and third sector partners here with us in person and online today. I'm not going to read out everybody's name because the challenge will still be here at that point. So what I would ask though is when people are coming in, if you're speaking, if you could introduce your name and which service area or organisation you're from, that would be helpful just so everybody knows who's who. So with that, I'll move to pause, and I'd like to invite Councillor Fiona Thomas and Cathal, who is online, to begin their presentation on behalf of the Evolve Partnership. And for people who want to follow along, there's an accompanying report, which was just reviewed in the paper. Councillor Fiona Thomas.
Thanks very much, and thanks to members of the Commission for having us here, but importantly for looking at this strategy at this point. As you have mentioned, it is a critical time for us as we developing the new strategy. I'll just do a verbal opening remark, then I'll pass you to Alice online, who will take the members through the slides this evening. The current, the violence against women and girls strategy for 2025 to 2028 is being developed at the moment and is currently underway with input from partners and public consultation at this point. So we still invite people who might want to contribute to that online to contribute to the consultation. Tackling violence against women and girls is not solely the council's responsibility, but also involves partners, including the police. It's good to have the acting borough commander here with us today and the lead on the BCU vote up here as well, NHS and other organizations. Our strategy adopts a partnership approach that unites these partners and establish a comprehensive plan to eliminate violence against women and girls in the borough. Our strategy in Hackney and the action plan applies the public health approach to tackle and reduce gender-based violence. This approach treats violence against women and girls as a preventable public health issue, recognizing that VOG is a consequence of factors such as adverse childhood experiences, harmful attitude, beliefs, traumas, and influences held socially or within the community that can be addressed. So this is why we, as our strategy, focus heavily on our work in Hackney on prevention. And I must also mention the work we have done with the police and commend the efforts of the police in terms of holding perpetrators to account in Hackney and other partners. Yasmin will be able to correct me. There was a point a few years and our BCU had the highest rate of detection and prosecution rate in London when it comes to violence against women and girls. Hackney was the first borough to carry out a public safe space consultation with our residents to identify where our women and girls feel safe in order for us to make things better. And the final thing that I would say is that we have a pool of statutory partners, and many of them are in the room today. They will introduce themselves if they are asked to question, as well as voluntary organizations that we're collaborating with in Hackney to tackle violence against women and girls. Proud of the work we have done. We need improvement. Many of our initiatives in Hackney are first in the country, but we would like to continue with this pathway, and your input tonight will be greatly received. Thanks very much, Chair. I'll now pass you to Kahan, who's got the slide to go over.
Thank you, Councillor Fiona Thomas, and hello everyone. So my name is Cathal Ryan. I'm a service manager in the Council's Domestic Abuse Intervention Service, and I'm the lead officer for eliminating violence against women and girls. And I'll be speaking, as Councillor Fiona Thomas said, about a review of the strategy so far from 2022 to 2025. So I'll give an overview about the strategy. and then I'll speak about progress made against the 4 priorities that the strategy has. I'll speak a little bit about the next strategy and what work we've done in preparation for that, and then I can take any questions. So the strategy that we've had from 2022 to 2025 has reflected the national strategy and the London Mayor's strategy. The 4 priorities map onto those of the national and London strategies, so preventing and reducing violence against women and girls, supporting all victims survivors, holding perpetrators to account, and building trust and confidence. We have overseen the strategy through the Violence Against Women and Girls Strategic Board, which in itself is a subgroup of the Community Safety Partnership. The board, in turn, oversees a number of subgroups which take forward specific elements of the strategy. So, for example, with regards to harmful practices, high-risk domestic abuse, sexual exploitation, and so on. Okay, so the first priority of the 2022 to 2025 strategy has been preventing and reducing violence against women and girls. So I'll take you through some of the elements of that. So one priority that we've had and focused on very strongly is to ensure that children and young people develop positive attitudes, and we steer them away from problematic gender-based attitudes and attitudes that will in future shape misogyny and domestic abuse. So Hackney invented and continues to use a set of tools that enable practitioners to identify and challenge problematic gender-based attitudes and behaviours. The tools allow people to screen and then intervene practically with young people. Also, on a more systems level, and some colleagues in the room today can speak about this, I'm sure, Hackney has done a lot of work in settings such as schools and youth hubs via Young Hackney and via Hackney Education, so that anywhere where young people go becomes a safer place, particularly for girls. Another priority within this strand has been to help children and young people who've experienced domestic abuse or violence against women and girls heal from the trauma that that causes. So in December last year, Hackney launched the City and Hackney Trauma-Informed Multi-Agency Guidance that enables practitioners to better identify, work with and support children who have experienced domestic abuse in the homes where they've grown up, and of course help the parents as well of those children to join in the recovery journey. Alongside that, we deliver training in a number of ways to practitioners across the partnership to help them identify and respond to trauma. So we focus on domestic abuse and its effect on child development. We also have, through the health strand of the partnership, training specifically on adverse childhood experiences. We do a lot of work in Hackney around raising awareness about violence against women and girls and the pathways to support. So many people will know we have annually what's called a 16 days campaign. So between 25th of November and 10th of December, we have a concerted partnership approach to raising awareness about VOG and domestic abuse. We also, in that time, focus on specific areas that we want to highlight with the partnership and with the public at large. Throughout the year, we deliver a large amount of training and case consultations to practitioners. In recent years, we've really increased the amount of practitioners we've trained and to whom we've provided consultations. And all of that will help any resident of Hackney who encounters any service in Hackney to be better understood and better helped in a more timely way. We've begun last year co-locating staff from the Domestic Abuse Intervention Service within the 4 main child and family hubs, along with other settings such as police, substance misuse services as well. And that again helps spread that awareness and spread that understanding of domestic abuse and VOG across the partnership. All of that work that we've done to raise awareness through campaigns, provide training, provide consultations and co-location, we've seen the consequence of that in that there's a larger number of victim survivors of domestic abuse being identified and referred to the council's service We think that is a positive thing because we know that by its very nature, domestic abuse is a hidden phenomenon. So the more people who can see it and support people to share their stories and be signposted to help, the better. Alongside that rise in people being identified and referred, we haven't seen a rise in the same way of high-risk domestic abuse. And that bears out the hypothesis that we're identifying problems sooner, intervening more quickly, and thus preventing greater harm happening in the future. We've also undertaken, through our community safety colleagues, taken the lead on training with the nighttime economy settings. I'll let community safety colleagues speak more about that, but a really impressive record of over 3,700 staff in the nighttime economy settings have been trained since 2019. We focused also, as Councillor Fajana Thomas mentioned, on safety in public spaces. So we conducted the public consultation that was mentioned, and then we took action in a very visible way to reduce risk in any locations that have been identified as problematic in terms of women and girls' safety. There are regular campaigns within the nighttime economy, and again, I'll let my colleagues speak about that. And also, we continue to respond when, as a council, and with police and with the third sector working together, whenever specific locations are identified as being problematic. And then the last strand of the prevention and reduction of VOG priority is about challenging attitudes that underpin violence against women and girls, because we know that it doesn't happen in a vacuum, it doesn't happen suddenly. Often misogyny and attendant behaviours grow over time. So we have to counter those messages. So we do so through, as I mentioned, work with Young Hackney, the council's youth and play service, in youth hubs, in schools as well, with our colleagues in Hackney Education, help supporting schools to do that. We deliver training on bystander interventions to help people help others who experience violence against women and girls in public places. We have a Violence Against Women and Girls Eliminating Champions Forum. So we help practitioners across the partnership to become more confident in helping their colleagues address violence against women and girls. We have the Don't Cross the Line campaign within the nighttime economy, which we'll speak about later, I'm sure. And again, we have those screening and intervention tools that I mentioned. Also, we have in Hackney last year invented and launched the country's only particular pathway around identifying and intervening for extra-familial risk, that is harm outside the home that young people might experience, and domestic abuse, because we know that the dividing line between harmful peer relationships and harmful romantic or sexual relationships can be very porous. And because of that, we have a pathway to help practitioners deal with all kinds of harm that young people might experience in those fields. Some of this was mentioned already in terms of the support that we offer for victims and survivors. I think Hackney is really characterised by the fact that we have a very robust whole system approach to eliminating violence against women and girls. We deal with domestic abuse, sexual exploitation, harmful practices all in the same way. We identify the problem, work together as a partnership to intervene, and then we reduce harm and promote safety. So the council's own domestic abuse intervention service is distinct in many ways. So we're a council provided service. We work with residents at any level of risk. We work with them for as long as they need us and in a way that they find helpful. We'll go and see them wherever they need to be seen. We work with the whole partnership to reduce the risk. I think the fact that we are distinct in those ways is a large contributor to the fact that since the service was launched in 2016, nobody who's ever been referred to our service has ever been killed. We saw a rise, as many areas did, of high-risk domestic abuse during the pandemic period. There was a 40% rise in domestic abuse referrals that were high risk. Since then, since 2022, the numbers have remained stable. We know that systemic racism and attendant inequalities make Black and global majority women more likely to be harmed, and also often to receive services that aren't as helpful as they need to be. We have done a lot of work in that sphere, and Black and global majority women are disproportionately referred to us, but also disproportionately seek help themselves from us. 93% of those who give feedback on our services say they'd recommend the service to a friend or a family member who was being hurt. And in the over the lifetime of the strategy, we've seen a larger number, so 50%, 51% higher numbers in the last financial year than in 2021-22 of referrals into the service. The council has met that demand through ongoing investment, as well as we've taken that partnership approach to make sure that the whole partnership has a role in addressing domestic abuse. We have extended our services in recent years, not just in terms of the casework and crisis intervention, but also we've moved into also providing trauma recovery work for survivors of domestic abuse. We know that children in particular are harmed through domestic abuse, and last year, as in previous years, 19% of all children referred or assessed by Children and Family Service were domestic abuse was a factor in that. Hackney has led the way along with Waltham Forest since 2019 in pioneering an approach called Safe and Together, which increases safety for children, as my report kind of laid out in more detail, and the council continues to adopt that approach. Yes.
Thank you. Thanks for the really interesting presentation so far. Just to flag, I think we've got until 7:25 for this.
Okay,
if it helps us with everyone, all commission members should have read your very detailed report that you provided. So if it's useful to just pick out, the really key bits that you want us to take away, and you might want to do that just so that we finish. Maybe leave enough time for questions. Thanks.
Yeah. Okay, sorry, thank you for the prompt. Okay, so I'll rattle through then. So supporting victims and survivors, I've set out in the report the numbers of ways in which we've addressed specific issues. In terms of housing, I'll skip past that because I know that colleagues here can speak to the excellent work that's done in that space. In terms of as an employer, the council has strengthened its provision of leave for any employee who's experiencing domestic abuse. We've taken steps in terms of sexual exploitation to strengthen the local approach to that as of last year. We continue to do disruption and deterrence around perpetrators of domestic abuse. The report sets out the domestic abuse prevention programme and the results that has had. That's the council's in-house intervention for perpetrators. We've done a lot of work since over the last few years in terms of intergenerational domestic abuse, helping people who are being harmed by family members. I'll let, again, community safety colleagues speak about nighttime economy. And I guess just to conclude, we have strong pathways around a number of different approaches, such as high-risk domestic abuse, around FGM, female genital mutilation, around sexual exploitation, and we gather data to help us continue to improve in those spheres. I've touched on training and development already, just to say that that continues, as well as any learning from domestic homicides, which is also taken forward in a very robust way across the partnership. And I've set out in the report the work we've done in terms of building trust and confidence around ensuring that everybody in Hackney has a high quality service and that people can access a range of services. So we've repurposed funding, for example, to provide a specialist service independent of the council for Black women of Caribbean and African heritage. We do specific work alongside groups that work with marginalised communities. And we have the Hackney Domestic Abuse Risk Assessment, which is the only one in the country that has prompts for practitioners around anti-racist practice, LGBTQ+ status, disability, intergenerational abuse, and extrafamilial harm. Would you like, I realise I've gone over time. I can say a little bit about the next strategy.
Yeah, there's time for that. Thank you very much.
Okay, no worries. I'll stop there.
The next thing is fine if you want to just run through.
Oh, sorry, it's fine. Oh, sorry, it's fine. So as you mentioned earlier, we're developing the next strategy. We hope to launch it in November, December of this year. So we're in the process of gathering information, putting it together. As part of that consultation work, we've met with over 500 people directly through over 20 different events. We have the online survey that Councillor Fajana Thomas mentioned earlier that closes on the 3rd of October. So I would encourage people to give their feedback. We're awaiting the national and the London strategies. We will obviously make sure that ours complements those, but ours will be very much a local strategy. And the 4 priority areas we're looking to have are raising awareness and developing practice, preventing violence against women and girls and tackling misogyny, supporting victims and survivors, and holding perpetrators to account. So there are some similar strands, some differences from the last one. And yeah, that's all the slides. So I'm sorry I went over in the earlier sections.
So thank you for the presentation. I think one of the constants with this being taken so seriously is there's a lot to say. So thank you for setting that out, and we can pick up on some further stuff with questions, which is what we're now moving to. And obviously we've got a lot, as well as hearing from the council, we have a lot of other partners in the room as well. So when we're asking questions, we'll try and direct that to who you think is best placed to answer it. But if you think there's a question that you need something to add to, you indicate, I'll try and bring you in. So we've split the questions into 4 sections, which address the current statutory priority areas. So preventing and reducing violence against women and girls, supporting all victims and survivors, holding perpetrators to account, and building trust and confidence. We've allowed about 20 minutes for each to cover each of those 4 areas. So please could I ask that if it's possible to keep the answers as short or to the point as possible, that would be great, just because we do have quite a few questions for you to get through. So I'll pause there and see if committee members would like to come in with questions. This is under preventing and reducing violence against women and girls.
Thank you, Chair, and thank you for the presentation and the report. This is directed at Councillor Fajana Thomas and officers, I suppose. One of the points that was raised in our consultation on the next strategy is a lack of consistency in programmes in schools. So I'm keen to hear on the progress that we've made in the last 3 years delivering broad programmes in our educational settings, what that looks like, but also what work we've done with education settings to ensure that they are taking up our offer or developing their own curriculum, particularly noting, of course, the points 1.1 and 1.5 focusing on attitudes. But then on the other side of that, it's been raised that there's a feeling of a lack of consistency from our responders.
Thanks very much. I'll start and I can bring Pauline in. Just to where I will start from, Chair, is that the point to establish that our schools have their autonomy. We cannot actually, we want to work with school, we want school to put initiative in place, but as a council, we cannot impose on schools on what to do. We encourage and we support them to be able to deliver. So just wanting to make that clear, that might be the reason for inconsistency. If a head teacher said they're not really buying into what we are selling or what we're encouraging them to do, there's little or nothing we can do than to get our colleagues from the education service to engage more with them. Pauline, Kaha, do you want to add to that?
Thank you, Councillor Fajana Thomas. Actually, I'm going to hand over to my colleague, James Sykes, who's the Safeguarding Lead for Education, to start out with.
Hi, good evening, everyone. Thanks for the opportunity to present to you. In short, there's a number of strands of work organised alongside DACE and the VOG strategy that Hackney Education are involved in. And top line, I suppose, I feel quite confident that designated safeguarding leads are aware of and sensitised to the experience of children living with domestic violence, and they are still one of the primary users of the MASH consultation line. With the support of DACE, we offer the designated safeguarding lead forum to all DSLs across the borough, and those sessions have been happening 3 times per year, where DACE staff come and deliver directly to our designated safeguarding leads. There have been a number of sessions over the years, and DACE have been long-term supporters in relation to those forums. Hackney Education also promote any of the materials that DIS and the Vogue Strategy Working Group send to us directly to designated safeguarding leads. During the 16 days of action, there have been a number of DIS organised events directly targeted at children, children's designated safeguarding leads, and we're just in discussions about formalising the final date for this 16 days of action coming forwards. There's a number of other areas that schools are expected to adhere to: keeping children safe in education, updated every year in 25. There's a real focus on additional vulnerabilities for children and young people, including those looked after, those with SEND, and those experiencing familial issues like substance misuse, mental ill health, and domestic abuse. And there are some strengthened links between familial issues and exploitation, and all of that then is updated in our model safeguarding policy that we send out to all schools and settings, and the training that we offer across a range of different tiers of practitioners within the education sector. In keeping children safe, Operation Encompass, the Met Police Alert System, is again referenced, and there's been good sign up from Hackney schools and settings to that process. I'm in semi-regular contact with a named Met Police officer, and there's an Operation Encompass website for schools staff that has good resources and information for those settings. Training in schools delivered by primarily me occurs at 3 different levels. So we deliver whole school training, designated safeguarding lead training, and refresher training for DSLs, and training for governing bodies. And all of that training then has key elements in relation to domestic abuse, including referral pathways, local and national resources, and that sensitization to children's experiences. I met recently with voluntary and community sector organisations through the Youth Providers Network organised by Young Hackney, and met with 35 organisations working directly with children and young people across the borough to offer safeguarding policy support and training. And that will culminate in a session before Christmas where those 35 designated safeguarding leads come, and we work with them to develop their approaches to responding to domestic violence and domestic abuse. Also offered training through the Hackney Holiday Food and Activities Programme to another 25 voluntary and community sector organisations, and internal staff training at Hackney Education, all of which include the elements that you would expect in relation to domestic violence and domestic abuse. Hackney Education, our panel members with both a gangs panel and the extra familial risk panel, and that gives us the opportunity to be able to engage with the wider partnership around these issues, of course, but also directly with schools and settings and their designated safeguarding leads on a needs-led case-by-case basis. So for primary schools, there does seem to have been more requests for support, particularly around boys presenting misogynistic behaviours towards girls and female identifying staff. And the pathway in relation to those requests is to signpost schools and settings to Young Hackney, who've redeveloped their offer to include misogynistic attitudes and behaviours. So as mentioned, there's a number of strands. There's been the centre of that, but I think that there's good cross-agency working there.
I think, so Joseph, did you want to come in? Leave your hand up online.
Thank you, Chair, and thank you for that. So my question was also about prevention in our educational settings. And I suppose just as a follow-up, I mean, you touched there on these boys in primary school. The Children's Commissioner says a quarter of young people first seeing porn at primary school now, which is obviously shocking and very worrying. And I guess, I suppose just in terms of attempting to counter that and to counter these really damaging things that children are seeing online, younger and younger, I'm wondering, everything that you said sounds really positive, but can we say definitively that every child in Hackney is having classroom discussion and education around things like consent and sexual violence, and at what age is that happening? currently, or is it more on an ad hoc basis, or reacting to concerning behaviours? Thank you.
Shall I come back in there?
Yes, that'd be great. Thank you.
Okay, I don't think I will be able to say absolutely that 100% of children get those messages at all times, partly because parents and carers still have the ability to be able to absent their child from sex and relationship education, although all schools are expected to have a clear PHSE approach that includes teaching children about safeguarding specific issues, bodily autonomy, consenting and healthy relationships. And as mentioned, Young Hackney supplement the work that schools do internally to be able to address those issues. There's also in the statutory guidance an increased focus over the last 2 years in relation to filtering and monitoring. Historically, filtering and monitoring in schools was done almost exclusively by the IT team. Keeping Children Safe in Education 24 placed the responsibility for oversight on designated safeguarding leads, and that's been maintained then in the 25 iteration. Lots of the best information that designated safeguarding leads access, including training for governors around filtering and monitoring, comes from the London Grid for Learning, which is a trusted partner in relation to online safety. So while it would be difficult to give you 100%, I suppose, there's good work and coordinated work to ensure that designated safeguarding leads, and therefore children in schools, get the access to the support that they need around online safety.
Thank you, James. Just because in your presentation you mentioned about the pathway for schools to request support from Young Hackney, and I just want, not that you covered the data effectively, but I was just to get a sense of how frequently those requests come through, and if that's something that the service area is always to be able to respond to all the requests that come through.
Yeah, those requests are sporadic, I suppose, and often, to come back to Claire Joseph's point, based in incidents that have occurred in a school, although the universal offer through Young Hackney is something that many schools take advantage of, and certainly during the training for designated safeguarding leads, I signpost them to training opportunities through DAYS or Young Hackney or a range of other services in relation to upskilling designated safeguarding leads, in relation to the multifaceted nature of the work that they're involved in.
Thank you.
Thank you, Chair. I just had a follow-up question. So how does it sort of work? So we've talked about all types of, how do we encourage all types of schools, so like HAVE schools as well? So we can just stand on that thing.
Can I just check if, James, if you heard that question okay? It was a question about how essentially we also work with education settings that aren't maintained settings. So for example, independent-based schools. And yeah, how do we work with those settings?
Yeah, I mean, I've got good links with some independent schools, although not all. I think that's relatively representative of much of the work. I don't have any further data in relation to what we do as a broader wellbeing and education service around that issue, but I'm sure I'll be able to speak to my head of service and get that information for you.
Thank you very much. Looking at Commissioner members for any other questions that you want to ask. This is again on the topic of preventing and reducing violence against women and girls.
Sure. So one of the strategies and intended outcome is that women and girls are safe in public and online spaces. So my question is, what sort of challenges we had over the sort of past 3 years, and what actually sort of how can we rephrase it? So what actually works and what sort of challenges we have, and how does the police or the community safety teams encourage reporting of sexual harassment, and how does it work with the nighttime businesses as well?
Yes, please. Jerry, do you want to? I can take the basic of the night from it, don't think so. Since April, this happens all the time. We have trained 452 individuals. These are staff working in bars and nightclubs, etc., on wage into welfare and vulnerability things like aspiranter, which is a day. So a woman goes into a business and she's concerned, she'll go up to the bar and just say aspiranter, and a member of staff will take it to a safe place. So if she's woman is being harassed by men, for example, that's how we work with that scheme. We also do conflict management for staff, and we're also, one of the things we're already doing is the drink spiking awareness campaign, which we're working in collaboration with Turning Point on that as well. So that's what we're doing in that. We have engaged separate from that in relation to the vote on 497 nighttime economy venues to be sure they're all aware of the Aspiranter campaign, for example, and any issues. They should have posters up in toilets so people are aware of there's any issues, what they can do. I don't know if you're aware, we have a Hackney Nights portal. You can just Google Hackney Nights to see that, and there's a number of all the licensees, license granted are on that, but we've got an additional 36 sign-ups since April on that as well. And one of the things we have done with Councillor John Thomas has led on this is the introduction of an evening and nighttime economy strategy. And as part of the evening and nighttime economy strategy, one of the things we're working on is creating an interactive map which includes bus routes, safe cycling routes, accredited venues that allow toilets for the use of the public. So we hope to have that ready for October. And one of the things we're also going to do in this quarter, following on from the approved strategy unit, is to have a night forum so we can actually show the action plan that follows on from the approval of the strategy by cabinet is actually living document. And we're actually addressing all the issues that came up with the consultation at the time of the evening nighttime economy strategy. Carol made reference to welfare points. So last weekend was Breakfast Weekend, so we had a welfare point showed into the nighttime economy on Friday and Saturday, and we actually engaged with over 1,000 people. Came up with offer free phone marking in conjunction with the police. We do give them free water, we charge people's phones, we point them in the direction of a taxi, all that type of thing. And having said that, we work really closely with the police, and that is not just us. The town centre police, which are funded from Late Night Levy, do a lot of work with us, and that will work really close partnership. And Jackie Vorkanan this year made a video about Vogue and the nighttime economy back in May. There was a huge number of things in social media. We are again repeating the Freshers Weekend welfare area this weekend coming, and we will do this again for Halloween at the end of October, and then at the launch of the 16 days of action, we'll have another welfare area in Shoreditch, those two that weekend on Friday and Saturday, where we'll launch the Don't Cross the Line campaign, which we work in conjunction with Town Hamlets, the City of London on, and that's all to do with violence against women and girls, what we're doing. And as I say, it's not just a partnership, it's not just us, it is a partnership with the council as well. And I know this is in the just want a quick mention of something, which is will be a consultation 22 and 23 about public-based Vogue, and where people were invited to pin-drop areas where they were actually concerned about violence against women and girls. And as a result of that, then we prioritised 6 areas where different things were done. We conducted environmental visual audits to improve those 6 locations. Several things we did was about cutting back foliage, increasing street lighting, introduction of additional CCTV in those areas to make those areas safer for women to be out at night, so they weren't in fear when they were out and about. So there's a huge amount of work we have done the nighttime economy, and we're continuing to do. And obviously, we have a late night levy board to carry all these issues and discuss as well as the late night levy board is. And that's the partnership between the council, the police, and the venues. So it's not just one or the other.
Can I give it to
Go on.
So just on the back of Jerry, because you asked, I think, around the challenges. So one of the challenges that we've had now for probably going on for over 12 months is, it could probably sound like easy to resolve, but it hasn't been easy to resolve. We are very much as Community Safety Partnership data driven. So we analyse and identify the key areas and the hotspots of the premises, etc. And this isn't trying to disparage the police, but we have had significant problems with sharing proper data and accessing proper data. Now, this has been going on for a long time, and we've put a variety of different sticking plasters in place. So recently, but again, it's not going in a straight line. We've been able to say, for example, in the nighttime economy, these 4 or 5 premises are where the biggest number of serious sexual offences are happening, and therefore we're able then to intervene with prevention in mind. So, but that's not through I don't think it's a willingness thing. I think it is a strategic decision taken by the Met that they're not prepared, and it's not just Hackney, it's across London, to share the crime data and the level and the detail and the intelligence and the analysis that we would like. And I do think that fundamentally attacks the efficacy of our partnership.
Thanks.
I think, yeah.
Okay, the place do you want to say?
Yeah, I'm not sure if I misheard what you said at the beginning, but did you talk about online Borg as well? Because I think I'm also really mindful of time, and I think Jerry's really helpfully articulated a lot of the work that we do, particularly around the nighttime economy, and I don't really wish to repeat what he said, but I think it's really clear that we've got a really good working join up every weekend, weekly tasking, as we're kind of hand in glove around that. I understand Maurice's point as well around the data sharing. It's probably a sidetrack to this more sort of theme specifically, but I think just in relation to the online thing and question, I think almost every single harassment and certainly every single stalking case that we get has an online element. And I think what that shows is the prevalence now of the way in which people are being harassed and or stalked online, either through social media, through use of WhatsApp. Obviously phones now are little miniature kind of computers, and we are also trying to adapt and develop our own technology and capability in terms of evidencing that, which can be really challenging when we've got social media companies that are based over in the US. So there's new kind of legislation now that's available to us to help compel the Americans basically to give us evidential packages, which we previously would otherwise struggle with. So that's very much in its infancy, but I think it's just really kind of drawing a picture as to show how much of a digital footprint there is now on Borg, and of course trying to balance the needs of victims with without taking away their phones, but also needing to evidence offending behaviour prior to actually apprehending an offender. There's a real balance and kind of sort of practicalities that we have to sort of take into account. But Yasmin, do you want to do anything else to say about online, or is that?
No, I think stalking wise, we've seen an increase of about 1.6%, so 3 offences from last year, but arresting wise and getting them into conviction from charges are on top, 16.3% as for last year. So it just takes time to build up cases and do the charging because of the online and the cyber stuff. But we are making really good progress around that. And then what I did want to just say is about the data. I think over the last 2 months, we have got some spiking in sexual assaults data, which I have shared with the nighttime economy team. So we're getting there now, and we've identified some premises as well around the nighttime economy and stuff. So we're going the right way. Yeah. We did have the Connect system brought in just over a year ago. So it's just collating the data and getting the system, work and all the flagging. But hopefully we'll be all right, Mark and Jerry. Yeah. Okay. We're working on it. Yeah.
Thanks all. Can I just, I'm conscious of time, make sure we get to the other bits. I'm just going to pause check there's not any other burning questions on that. And if not, we're going to move on to supporting all victims and survivors. I think if maybe some questions that they want to come in on. Yeah.
Yeah, my question about the mental health support. How are victims of EHWG and their children get mental services. And then what works well and what values exist, especially those we are managed by others and also related to that price.
Sorry. Yeah, that's what I was going to. Even myself, I couldn't hear Councillor who said very well, but I didn't want to interrupt.
Do you want to? You sure?
Yeah, sure.
So I think what Councillor Osmond was keen to ask about was when we had the focus group with providers of specialist services, one of the things that group raised with us was a potential gap in capacity and funding for support that addresses the link between domestic abuse and mental health. And so we were keen to understand as a commission what the approach is locally to address mental health needs for victims, survivors and their children. If you could understand what that looks like in practice, and if there are any barriers to accessing that offer, and I think as I was particularly keen to understand how we work with language barriers as well.
How do you want to come in?
Yes, I can do. I think there is a shortage of provision nationally and in London for survivors of domestic abuse to recover from the trauma they've experienced. And I think that's been raised at a number of different levels. Locally, we have a range of third sector VOG agencies, some of which do offer therapeutic and counselling services within a specific language or languages, dependent on the by and for nature of the agency. So, for example, I know our colleagues in Imiche offer domestic abuse intervention and they offer counselling as well for Turkish and Kurdish speaking victim survivors. We, as I mentioned in my slides, as a council service, have expanded our provision so that we offer recovery from domestic abuse trauma for victim survivors. I know that in the NHS, there's also been work done in the last few years, and maybe some NHS colleagues might want to speak to this, whereby talking therapies services have become more proficient and expanded their capacity so that they can better address trauma caused by domestic abuse. I know that the London Mayor's Office funds a wide range of provision in the third sector, and many of those services are on a pan-London basis offer services that are therapeutic in nature, but there is a problem of waiting lists across London. So it's definitely something that more needs to be done. We locally, I think, have done a lot, but more needs to be done on a London basis and a national basis to expand services, because obviously people are still waiting longer than they should be for the help to enable them to recover.
Thank you. That's
no, I just want to add to that why going by the gap in referring to the council and commissioning, Taha mentioned it briefly that majority of some of our voluntary organizations are funded by MOPAC and they're London-wide, so they're able to support people that we in Hackney as well. And Imiche, Taha, you did mention this, Imiche is one of the organizations we commissioned in Hackney to work with Black and global majority women supporting them, and Imiche themselves. I'm not sure if Imiche is online. They support Turkey. Oh, that's sorry.
Yes, my name is Chida. I'm the Info Service Manager at Imiche Women's Center, and like Paul said, there is a high demand for mental health services like counselling in Turkish, Kurdish. We provide, but we stretch our capacity, and the demand is there, but we can't always provide, and we end up making referrals to partner organizations. But yeah, the demand is ever increasing all the time. One thing I can add in terms of the challenges that we have is probably not getting in at timely intervention from the mental health teams. not just in Hackney, this is a London problem. We do lots of safeguarding referrals, but I know the services, mental health crisis teams are also overwhelmed. But yeah, that has to be addressed. Yeah, that's all I can say.
Okay. So that's the board platform and then wider. Yeah. Yes, right.
Domestic abuse offences for year to date have increased by 9.1%. So compared, so we are getting more victims than that, and hence the need is going up.
Yes. Yeah. I just want to add one more point as well. On a case by case basis, if there is particularly a domestic homicide, particularly if there's sort of indicative issues around mental health and or other obviously wider concerns, we'll always take that really seriously and take on any recommendations, either from a police perspective, obviously with colleagues in health as well, as to how and why maybe that could have been prevented, or if there's anything more that health services could have done around mental health, particularly within obviously domestic homicides. So it's just another way of addressing that gap and or identifying any root causes.
Councillor Joseph, I can see you've got your hands up. Would you want something on that? Or
Thank you, Chair. No, I wanted to talk about housing.
Is that because we're going to bring in housing? So I'm just going to follow up.
Sure.
Then I'll bring you in for housing. Sorry, you're going to follow up on that.
Yeah, I wanted to hear more about the domestic homicide reviews, because it's mentioned in 4.3, but also in section 2.1 of the report, it's mentioned that nobody had been killed by the intimate partner having been in the abuse intervention service or discussed at Merrick. But that is only people who have been referred into our systems and our services. So I'm keen to hear from both the police and the council what that review looks like, and how we assess whether those people should have been in our services. If there's something we could have done to make that happen.
Do I start? Perhaps you want to comment? Thanks very much for that question, Councillor. The whole point of domestic homicide review is what you just described. It's all saying, as you saw in the report, no one has been within the service of Hackney Council that have been killed by the partner, which means these people are not known to us, and these people we know there's been 2 instances in the last 1 year that even the police, they're not on the radar of the police apart from reporting a phone theft. So it is difficult why we do those reviews to look at what can we learn from this. How in the future, how can we pick something up from looking at this review, looking at this family? Have they been in contact with other services that could have spotted that there are issues within that relationship and bring it to our attention either by referral or by the police? But usually Kahad leads on our review. Kahad, you want to come in?
Yes, certainly. Yeah, I'm happy to speak to that. So when a domestic homicide happens, there is a statutory process, the domestic homicide review. Of the reviews that we've had in recent years, so I'm speaking specifically of between 2019 and 2022, the 4 reviews that we conducted fully did identify that there were opportunities during the lifetime of the relationship between the person who was killed and the person who killed them. There were opportunities for agencies to have better ascertained whether or not domestic abuse was an issue, and then to have intervened more robustly through, for example, sharing information, access and support, referring to appropriate services, and so on. So there were lessons. The reviews themselves involve the whole partnership, and the whole partnership conduct the self-assessments, as well as the independent chair making recommendations based on what they see. And through that process, their action plans are formulated, and those lead to service improvements within the agencies where gaps have been identified in terms of practice. So there's a process of improvement, of evaluation, and then hopefully the probability of future gaps occurring is greatly reduced. It's never possible to entirely fix the system and remove risk of error, of course, but the common theme that comes up through domestic homicide reviews is that if agencies are more curious, are more assertive in how they identify issues, if they share information at an earlier stage and work together to identify all the risks holistically, the probability of homicide is greatly reduced. And it's because the council works in that way, I think, that we haven't had any homicides in the thousands and thousands of people who've been referred to the council service. So the basic learning is, if people are working that way, probability of homicide is reduced. And that's why we always encourage members of the public, partner agencies, if you're concerned about a friend, a family, a client being hurt, please tell us, and then we can start to work in that way to prevent things getting worse.
Yeah, just as a part that goes on from that, so one of the things that was raised with us in the focus group was that Hackney takes the approach of having an in-house domestic abuse and intervention service. And while the studies were positive of that, they also noted that there were some people who were put off by approaching the council because the council being perceived as a statutory service, so people had no trust, for example. I just wanted we've heard a bit about commissioning in terms of imaging and the NOPAC provision, but it'd be able to know, first of all, how the service area kind of deals with that risk, with people being wary of approaching the council, and what assessment, if any, has been of the balance between in-house provision and more independent commission provision.
I can speak to that, if that's okay. So I think there is definitely a very valued and needed area of work which only the third sector can fill. So there will always be people who maybe are reluctant to approach the council, and because of that, we not only fund third sector provision ourselves, but we work really hard throughout the year to promote third sector agencies. So throughout all those campaigns that I mentioned, we're not only promoting our own service and pathways, but we host events, we signpost, we promote our rich third sector partnership as well. On a case-by-case basis, and our website also has details of all our third sector agencies as well. So it's really easy. So if somebody comes to the council and they think, maybe I need help, maybe it's time to sort of speak to somebody about a situation, they'll not only see our information, but they'll see the information of by and for agencies in a number of different languages, working with specific cultural backgrounds, so that they can find the service that best fits their needs. On a systems level, even if somebody goes to a service that's outside the council, we in the council will still help that service. So for example, we might get approached from a third sector agency because they're having a barrier with a local statutory partner. Even though we aren't working with that client, we'll still help when we're asked to do so, and help sort of ease the system issues to make the client of that third sector agency safer. Also, our service operates a bit like a multi-agency safeguarding hub, in the sense that when we get a referral, if there's a service that seems like a best fit, for example, a service that delivers interventions and support in a specific language that matches that of the client who's been referred to us, we'll speak to that third sector agency, and then, if possible, hand things over to them so that they can offer a service that's going to be easier for the client to receive help from. So we work sort of at a systems level and operationally and through campaigns very well, I think, with the third sector. In terms of the benefits or analysis of whether an in-house model is better, worse than a more commission-based model where all the services are commissioned, I have my own views, which I've already obviously expressed, that I think being an in-house service means we're really closely integrated with adult safeguarding, with child safeguarding, we can exercise a great deal of leverage through those safeguarding pathways in partnership with our housing colleagues. We can really help people very quickly because we're inside the system and we can bend the system to meet the client's needs. There are benefits to largely commissioned model. I know that some local authorities are moving from commissioning towards insourcing because of the benefits that I've outlined. So while I wouldn't want to disparage a more commission-based model, I think that for Hackney, the record of safety and homicide prevention stands as a testament to the benefits of this way of working.
You've also got the reporting into the police. So if you've got high risk cases or 2 or 3 repeat offences, then they would go to the multi-agency risk assessment conferences every 2 weeks. So that'll be in partnership with Caroline's team and housing and everybody else. So they'd come into the system that way and the support will be provided. And we've often held urgent MARACs or an urgent professionals meeting to help people. So, and it works, and it's really good that we have them every 2 weeks. Yeah.
I'm just going to bring it to where I've kept Councillor Joseph waiting.
It was a follow-up to this.
Okay, I'm bring Councillor Joseph to follow up, and then I've got forgotten you there.
It's on the point of victims and survivors' control of their data and their cases, because one of the points that was raised about it being an in-house service is victims and survivors have concerns about their data being shared with other services in the council. That was a kind of key strand of that. And another concern from our focus group was that victims are worried about reporting to the police without their consent or feeling strongly pushed to reporting when they don't necessarily want to. And so I'm interested in how we communicate with people coming into our service, our approach to reporting to the police, and how we ensure that they feel safe and in control of their cases and their data when they approach us.
Thanks, Councillor Gush. I'll bring Kaha in, but I think it is important to stress that before the domestic abuse intervention service will refer a case to the police, they need the individual consent. So, or they won't just send that to the police. I think it is important to stress that we won't force anyone unless there is a risk. We will do that, but you need the consent of the individual. So we're not forcing people. And again, to say this, the whole point of us raising awareness around violence against women and girls is to eliminate it. So if we are not reporting, we're not getting the enforcement bit to come in to stop the perpetrators. How then do we eliminate violence against women and girls? I knew there are some family settings, in particular from Black and global majority, that sometimes because of the stigma, because of the family setup, they might get to service and thinking, have a second thought. What would this do to my family? What would do to the settings? Someone from like myself of African descent, for an African woman to report their husband to the police, it is a major issue within the family. That might be, it's a barrier already. So, and that is the individuals such as that, we need quite a lot of encouragement or making them to make that decision to say, if you are not doing this, this cannot happen if approach us because we want this to stop. But we won't be able to stop the perpetrator or the abuser if we are not taking action. Can I bring Kaha in to discuss more, talk more about that?
Yeah, I think you've covered a great deal of it. I've just echoed that. You know, we don't share information without consent unless there's a risk indicator that means that we need to keep someone safe, and we have the exceptions to confidentiality and GDPR that sort of qualify that in terms of when when agencies need to share information without consent, it's always based on risk. And we'll also always, even if we need to tell someone, such as the police, about something very serious, we'll explain to the person why we need to do that and the reasons for it and the information that specifically will be shared. But it's relatively unusual that we would need to share information without consent, because we engage people in discussion, we explore the risks, we work to sort of understand their perspective, and then with agreement share information with those who need to know it. But there's certainly no uniform policy of sharing information with agencies because they've simply been referred to us. We'll always have that discussion first and explain things to the client.
I think we can meet victims in GPs, at hospitals, any appointments they've got, you know, we want to meet them to try and get that reassurance. If it's high risk and you've got children involved, then we would call them for keep an eye on children, you know. But if it is high risk, we can't really take that and ignore that. We need to do something, but we need to do it sensitively, delicately, and slowly try and get that person with confidence to say, what do you want us to do and how we can help you, and trust us, you know, we do want to look after you. So there are many ways of doing this, but we do it sensitively to make sure we've got people on board and we're protecting everybody. But there's also a perpetrator programme as well. So if they want to engage, you know, it's to prevent that reoffending, and that all comes with time and patience.
Thank you. So for Professor Griffiths, benefits, we're just on questions on the back of the girls strategy item. We're under questions list supporting all victims and survivors. So I can just bring in Councillor Joseph and do meeting.
Thank you, Chair. Thank you, everybody. Yeah, so I mean, in terms of housing, it seems to me that this is yet another area where the national lack of council housing is having a huge social and potential financial cost too. And I suppose I'd just like to highlight a few points and ask for the experts' kind of view, really. So the report kind of highlights that homelessness applications, many of them often result in applicants being discharged, as we know, to the private rented sector. And this is listed as a factor which, you know, potentially stops people receiving adequate support. So I wondered if perhaps you could highlight some of the issues there, if they're about kind of tracking people, and if people become more transient once they go into the private rented sector, if it becomes harder to support them, and if so, how. And then just looking at the domestic abuse protocol on housing, I noticed that a number of housing associations have signed up to that, which is fantastic. But one of our main providers in Hackney, Sanctuary Housing Association, I don't think I saw them listed, so I just wondered why not. Do they reciprocate? Do they participate in some way? And yeah, I guess I was just interested. So, I mean, for a long time now, there has been, you know, women that need to, not women, but survivors, generally women, who do need to move out of the area for their own safety, are often able to approach other boroughs or other areas. Now, obviously, we have a huge lack of council housing and an awful lot of vulnerable people jostling to get what is there. So I suppose I'm just wondering if there's any data on how many approaches we get in Hackney, for example, and how many we're able to grant, and similarly, how many approaches we make to other boroughs on behalf of our residents, and how many of those are granted, and how long the wait is for those victims, survivors. And I guess I suppose the last point that came out of the focus groups, it was stated that housing insecurity is both the cause and the consequence of violence against women. And I wondered if perhaps you might be able to elaborate on that. I mean, I'm guessing that bad housing and overcrowded housing is potentially a contributory factor to domestic violence, but yeah, I'd be interested in your views on that, I suppose. And just finally, you know, what lobbying, what statistics are being used to kind of put pressure, I suppose, in conjunction with our housing teams in Hackney, to put pressure on the government to actually fund council housing. You know, are your teams involved in that in any way? I'm sorry, I know that was very long, but thank you very much.
In first place.
Do you want to come in?
I can take the question around, sanctuary housing and, the involvement of the local, let's say, of registered social landlords with the local preference. So we've had actually today a so-called Hackney social landlord domestic abuse forum. And so I confirm that sanctuary housing has been attending before, not every time, but they are members. So they are, I would say that, they seem to be more responsive, I would say, over the past 2 years since we have started, the domestic abuse forum. And we could see this also in terms of, days, domestic intervention service practice, so the way they do interact on, specific cases with our intervention officers, which is positive. Unfortunately, I cannot comment on the reason why they have not, signed off the, the protocol. This is not obviously up to me, and it's something that we will repropose from time to time, to social landlords who have not signed off. So yeah, this is the situation basically with sanctuary housing. Yeah, so I can't really comment, I'm afraid, on that. I'm not sure, for example, they have never shared their, also internal policies and procedures around the domestic abuse, but we made sure that they are aware, let's say, of this guidance, which can be used, obviously, by them, provided housing providers.
Again, the only thing that I will add to that is thanks, Councillor Joseph, for that question. Bearing in mind that this landlord protocol is one of a kind developed in Hackney. Sanctuary is a big organization. They might be because of internal policy or their commitment. If this is not in other boroughs or not happening in other local authority, might be wise Hackney doing this. Probably what we need to do is to encourage them and encourage more housing association to join. So far, we got 20.
Yes, we are. I think it's 20 overall social landlords, which is, I think, overall is quite good. We know that it is locality, I say, to put ridiculous social landlords together. So I think that overall, this project can be quite a success. Also because it is ongoing. In fact, what we are trying to do now is also to try to involve them in providing some basic data around the domestic abuse survivors, their tenants basically in Hackney specifically. And yeah, so this is something that we are trying obviously to work on.
Right, but then one of the questions that best schedules at last as well.
Helena, you want to comment?
Yeah, thanks everyone. So I'm Helena Stevenson. I'm the Acting Director for Tenancy and Home Ownership Services. So I think some of the questions that you've asked about are more around the kind of private rented sector and homelessness, which isn't an area that we directly manage. And I'm not sure if Carol or anyone from BHP is in the room who might be able to answer those questions, but if not, I will do my best to maybe cover off some of those points as well. I think the picture that Councillor Joseph has presented around housing insecurity and this sort of knock-on effect, cause and effect around domestic abuse is really something we see a lot from the landlord's council perspective. We're obviously managing tenancies where we have people with joint tenancies, for example, where one party is the perpetrator and one party is the survivor. Some of those are parent-child, some of those are partners, and we know that the lack of housing options for the party that wants to flee, or the party who wants the other party to move out, definitely causes some of those relationships to continue and actually for abuse to continue. So it is something we're very, very aware of, and we are in fact trying to resolve with the support of the sort of national domestic abuse kind of sector, and also MHCLG, Ministry for whatever it is, housing, communities and local government. I always have to remember that acronym. We've been doing some work specifically around joint tenancies to try to see what we can do to manage those cases in a more survivor-centred way. What we tend to find is, yes, we can remove one party from a joint tenancy, but we have to have a really high evidential threshold to do that. And sometimes, as we all know, in domestic abuse cases, that isn't always forthcoming. Equally, one party can serve a notice to quit on the other party, and that ends the whole tenancy. We do sometimes see that happening, but again, quite often a survivor doesn't want to do that because of the risk of repercussions. And, you know, I think taking a really kind of harm minimisation and supportive kind of approach, which doesn't always appear like the right thing to do at the start, can sometimes yield better outcomes for survivors. So, for example, sometimes we need to think about housing options for the perpetrator. I'm not saying we give them a council house, but you know, there are other options that we can look at that will remove that person, because why should it always be the survivor who has to be the one to leave their home? And I think that's really important. So I think we're starting in my service, in the tenancy service, to get much better at taking that person-centred and holistic approach to the way that we work. There were some questions around people who do need to flee and who choose to flee. This is a constant challenge for us in the tenancy service. As you've alluded to, you know, if the local area that you're from is not safe here anymore because of a risk of violence, then you can approach any borough that you want to, or any place in the country, to make a homeless application, and you can't be excluded on the basis of local connection. That said, we anecdotally know that there is a tremendous amount of gatekeeping that goes on with other local authorities for exactly the reason that Councillor Joseph talked about, which is the shortage of housing. People are always, they always try to bat you back to where you've come from, which obviously, as we know, isn't the safe option. So I think my team are getting much better at being able to navigate those challenges with other boroughs, working really closely with our colleagues in benefits and homeless prevention. But I would say it is quite specialist work. It's not something that housing officers currently, as they're configured, would be doing every single day. And it's, you know, it's complex in so many ways. It's around the interpersonal way that we're engaging with survivors, doing that safely, the knowledge of all the legislation, the support, everything that's out there. If a housing officer is only trying to navigate this once every, you know, blue moon, it's not the best really outcome for that survivor. So one of the things we're looking at in our service is actually reconfiguring how we work with both domestic abuse perpetrators and survivors to put that work into a specialist team in housing. So instead of having it scattered around, it will be one single team which will be reporting into Wayne's current area. Wayne's in the room, and we feel that by having that expertise kind of in a smaller space with expert officers who've had better training and are doing it on the, you know, more regular basis, we're pretty sure that we'll get some kind of better outcomes out of all of that. So I think that's covered some of what you said. In terms of the numbers, I mean, we currently have around 25 of our council tenants who are in temporary accommodation as we speak because of risks that they face. Not all of those will be domestic abuse related. Some of them will be other types of risk, hate crime, harassment, those kinds of things. But a good chunk of those are domestic abuse cases. In terms of how many we receive from other boroughs, I wouldn't have that data. I think that would be something the Homeless Service would need to provide. So I think that possibly covers a lot of what you were asking about, but do forgive me if I've forgotten anything.
That was really helpful and actually covered a number of things that we were keen to pick up on, so thank you for that. And I don't think we've got Carol from Benefits and Homelessness Prevention, but Councillor Joseph, I'm sure we can note down some of those questions and pick it up for a follow-up outside of the meeting. Can I just see if anybody else has any other questions on supporting all victims and survivors?
Just want to add, oh, sorry.
Yeah.
I think the survivor's thinking about, can I pay the rent? Can I afford to pay the rent? Can I afford to pay for food? Are my children going to be near the school? I think that's really important around the housing. It's one we're thinking about moving them from X to Y. How far is it for the children? I think we sort of forget, don't we, how important it is for that.
Yeah, and I think that's something we all recognise from the piece where it's so that's thank you for making those points. Sorry, just kind of written down.
Thank you, Chair. We had a question around, how do we support victims with insecure immigration status and no access to public funding? So how do they sort of report and how do we support them?
Well, how do you want to come in and Hackney? I think this came up a question with our domestic abuse and intervention service. We support everyone regardless of the immigration status, but sometimes there might be services they're not able to access because they don't have recourse to public funds. So perhaps you need to come in to speak more about that.
Yeah, absolutely. So as you've said, Councillor, we work with everybody. So immigration status is never a barrier, nor is a financial circumstance. We work very closely with our colleagues in Welcome Hackney. So we have been supporting women and children in hotels for asylum seeking and refugee people. We've done a lot of work directly in those hotels as well, so that any issues that women and children are experiencing in terms of safety are addressed at a systems level within the accommodation. So we worked with the Home Office and the provider agencies that the Home Office use. We also challenge the Home Office very robustly, along with our colleagues in Welcome Hackney, when we think that the provision that the Home Office provide or their commissioned services falls short of the standards that we would wish for refugee women and children. On a case-by-case basis, we work with the partnership which I've spoken about before, and in these particular circumstances, that partnership will often involve linking people in with specialist immigration support, seeking to get them the help they need to regularize their status or to obtain whatever income is available that maybe they're not aware of, so to get them all the sort of help that they need. We also work very closely with our third sector colleagues, so Chida may want to come in about this as well. But the buy and forest sector has a real wealth of expertise in this field, so we'll often work alongside those specialist agencies. We undertake also particular projects, so we're just in the next week starting a project with a specialist agency, Kurdish and Middle Eastern Women's Organization, in partnership with Welcome Hackney, where we're going to be delivering a group for women in Home Office sourced accommodation to help them with anything related to gender-based behaviour and domestic abuse, to raise awareness and to promote the different pathways to support. So we do work, say, at the systems level through challenging central government and its providers, and at an individual level, and through that partnership approach.
Hi, sorry I was late. It was our Dalston Police Ward Forum. I just had a quick question on immigration status for the police. So I understand there's currently no firewall between the police and the Home Office. So you have to share someone's immigration status with the Home Office, which obviously is a huge barrier to migrant women finding and seeking support from the police. So I just wondered if you could speak to that. If Hackney's done, I don't know if Councillor Fajana Thomas, if you've ever raised this with the Home Office, because obviously it's a big issue that Women's Group's campaign for. So I didn't know if Hackney's making its voice heard on that issue.
I think, to be honest, I think it's the other way around. So we wouldn't necessarily know someone's immigration status unless, for example, immigration have noted them as wanted, and that would show up on like Police National Computer as an immigration wanted marker. So if I mean, I suppose it's also in tandem to the original question, we obviously wouldn't treat and or deal with anyone in any different way, irrespective of their immigration status, largely because we actually don't know. So that's obviously immigration status is a Home Office kind of decision, and so the point you make about the firewall is it's actually the other way around. So we would need the Home Office to tell us what someone's immigration status is, not the other way around. So I suppose the barrier would be their perceived barrier as to, you know, if they have like, you know, no recourse to public funds, obviously wouldn't actually make any difference in terms of accessing police services. But if they have like an unstable status, or, you know, there's issues in terms of appeals, etc., then we wouldn't be aware of that.
Voluntary sector groups do campaign on this and say that that does happen, that the police share that information with the Home Office, that you're like kind of bound to.
So if somebody tells us, but I suppose the point is the determination of an immigration status is a Home Office distinguished status, which they hold and hold the data for. We don't have access to any of that database. So we would need to ask the Home Office what someone's immigration status is.
Yeah, but if you're supporting a woman and her immigration status was disclosed at some point in that, you would be bound to inform the Home Office about that.
I mean, there's been lots of debate about it. Whether we're bound to would determine, I suppose, on the intricacies, or whether, say, they are, you know, maybe we know that they are wanted by immigration for an offence of, you know, I don't know, I'm not an immigration specialist, but say that they're wanted for deportation for whatever reason, and we knew that they were either in our custody, which is largely the sort of, you know, way that we'd identify that. So it's probably more likely to be a perpetrator. But yes, if we were in contact with somebody that we knew was wanted for an immigration offence, then we have to report that to the Home Office. I think if it's just a general kind of immigration status, then we wouldn't actually know unless they told us, because, as I say, the data is the state. Someone's immigration status is a Home Office matter and not a police matter. So unless the Home Office told us, and all the victims themselves,
it's the informing bit, not the making the decision.
I think we have to kind of just be really pragmatic. I think there's always a bit of a, you know, if there's definitely immigration offences committed, then yes, of course, as a law enforcement agency, we have to tell our law enforcement colleagues in the Home Office that, you know, this might be where someone is. But more broadly, if we know that somebody has an unstable immigration status, and or maybe they're going through a process or an application, and, you know, the Home Office might want to know where they are, then we wouldn't routinely share that information.
So then I guess you've got to the point in one of your earlier responses is that perception of that safety and how that plays out for migrant women. So I don't know if you can speak to a bit about how that barrier stops, if you think that is a barrier to women.
I think it is a barrier. I think much like we had an earlier conversation, an earlier question actually, Councillor Garbutt, around sort of the perception of the DACE being internally within the council, and that might, because it's, you know, appears to be as a statutory agency, that people might then not want to go to the, you know, get support from the DACE. I think it's the same sort of thing. I'm not, you know, in terms of the actual perception, I think this is where the voluntary sector really does kind of help and assist in that sort of encouragement and support of women. But I think we always have to say we have to be really pragmatic. Largely, the police don't actually know people's immigration status, so I think knowing that probably would help. But also, if we know that, you know, it's going to also put someone at risk, I think we have to take that professional judgment and think, well, if it is going to put someone at risk, then what is the benefit of us reporting any sort of information back to the Home Office, as I say, unless there is an offence that's apparent that they're wanted for.
Because I know it's something that, specifically an Assembly member as well, that the Mayor of London has said that needs to stop. And I just wondered if there's anything that we've ever kind of done around that.
I think locally within Hackney, or certainly for me within Central East, there is nothing that I can kind of deviate from at the moment, and without NPCC guidance and or maybe change to, you know, Home Office guidance or the law around that. There's nothing. I think my hands are relatively tied in terms of following a due process.
I was kind of
but no,
that's good for John Thomas to advocate then.
Definitely, like in Hackney with immigration, we actually support in terms of supporting, making a referral to one of the charities that support that can support them in accessing legal advice, and sometimes we provide people documentation letter to assist with immigration applications within our service. So, but like you said, Councillor Gabet is worth lobbying for and asking for that question, which is this is not a council issue, it's a wider issue that we can.
Yeah, it's just that barrier around migrant women getting support. Thank you.
Which was something, yeah, that also came up to this focus.
We had a case, sorry, about 2 years ago, and I think Carl knows about it. We had a female who'd been harassed about. We found her, and 2 to 3 days we actually housed her in a hotel because there wasn't any promises to do that. Then we found out that she had a boyfriend, but both of them didn't have the status to stay here. We contacted the Home Office and said, you need to help her because she's a victim of honour-based violence. And they said, well, bring her to us. So we took her to Croydon and they spoke with her and they said, we can give you status now, you know, because you're a victim, a survivor. And she said, but my boyfriend doesn't have that. And they said, well, we can't give him that. We can give you that status. And she said, well, I don't want the status if you can't provide it for both of us, if you're running away from the honour-based violence. So what the Home Office did was gave her documentation for her safety and said, okay, you're free to go, but if you ever change your mind, you come back. So by having that collaboration with the Home Office, I think they gave her that gateway that if she ever did become a victim again, because you don't know, do you, a new relationship, she could come back. So we've actually found the Home Office quite supportive, where we've, you know, worked with them around it. But it depends, isn't it, who you speak.
Yeah, it's the perception, isn't it?
But I can tell you that when you do speak personally, and I did get involved in that, I think, you know, we try and help all our survivors. Reassuring.
Yes, thank you.
I'm just going to, not because it's not a really important because I think we'll probably potentially try this question, but just because we've got a lot of questions.
Yeah.
I'm just going to bring in Councillor Savitar and then we'll move on to the next set of questions.
Thank you, Chair. Do you want me to ask the set question or the one that I was just going to ask following the conversation?
If it's a follow-up, if it's a brief follow-on, but if we could keep it brief at the point, just in the interest of time.
Okay, perfect. I'll ask the set question then, in the interest of time, and I will write the follow-up question to Craig, if that's okay, and get an answer out of the meeting.
That's fine. I was supposed to say then we're moving on to, thank you for moving me on to the next section, which is holding perpetrators to account. So if I can just bring it in. That'd be great. So if you could ask your question then.
Perfect. Thank you so much, Chair. Forgive me, everyone. The reason with the confusion is I had a tech issues and now I'm just catching up to the meeting like halfway. So thank you for your patience. And
So I'm going to suggest that we turn to see if there's any other questions from other members, and if Councillor Savitar joins us, I'll bring her in, and if not, we'll pick up her question. Oh, you're back. Okay, Councillor Savitar, you hear us?
Honestly, I give up on the internet, but we move. Okay, the question that I wanted to ask is we were talking about holding perpetrators to account, and as we know, it's not just a criminal justice issue. It's also vital that there's a system in place to reduce the risk they pose to women and girls, regardless of whether the police or the probational service is involved. So the two part of this question is, firstly, in Hackney, do we have a joint up approach to perpetrator management? In other words, are the criminal justice system, housing, education, and social care working together to prevent or disrupt or take action in that area? And can you share some of those examples? And second, what behavior change programs are actually available here for perpetrators? and how is our violence against women and girls partners collaborating to make these programs stronger and more effective and available for more people? Thank you so much, and apologies again.
Carl, you the best person to comment on that? Not be on the spot.
Okay, do you want to just to the first part of the question asking, I think because Councillor Samata was in here at the beginning of this session, we mentioned that the Hackney violence against women and girls strategy, it is a partnership strategy because we as a council are not the sole responsible. We don't have the sole responsibility for tackling violence against women and girls. There are other statutory organizations that are involved, and that's why we've seen many people in the room and online tonight, is because we work together. It is a joint working collaboration with partners.
I think just on that, I think Professor Samter is particularly interested to know about approach to perpetrator management.
How that's why I want to get
Yeah, sure. So, so in terms of a joined up approach, yeah. So as I touched on earlier, I think the council's distinctive in how joined up its approach is. So not only to support victims and survivors, but to sanctioning, disrupting, and then seeking to engage with perpetrators of harm. So particularly complex perpetrators where, for example, the victim survivor may not want to engage with the police, as is often the case, for example, with family abuse. So with intergenerational abuse, as we've termed it locally, which constitutes 20% of all our high-risk domestic abuse cases, it's most commonly mothers who are being harmed by their adult sons for very understandable reasons. These women often don't want to get their sons to be arrested or sent to jail. We nonetheless work with our colleagues in adult social care, in East London Foundation Trust, children's social care where there are children in the family, with the GP services, housing and so on, as well as the police, but not exclusively the police, to try to reduce the harm. So we can do things like we'll work with, for example, the substance and alcohol service for the perpetrator. So if he is better engaged in treatment, he might become more stable, and thus some of the severity of his behaviour may reduce. We'll work with services around the victim and survivor, for example, if she needs support with making her property safer, we'll engage with, for example, services in Helena and Wayne's directorate. We'll work with third sector provider agencies, maybe if she has culturally specific needs based on language or religion, or if she wants support from a very specific service. So we take that holistic approach, and even if a perpetrator won't engage directly with us, we can still do work around him using all the leverage that we can through all the agencies that we can to try to reduce the risk that he poses. In terms of perpetrator intervention programs, the council does have a well-established perpetrator behaviour change program, we refer to it as the Domestic Abuse Prevention Program. That's accredited by Respect, who are the national, I guess, body of the organisation of expertise in the country who accredit such programs. Last year, we became the only local authority program in the UK to receive accreditation, not only for our perpetrator behaviour change program, which is most commonly used for people who have been abusive to their partners or ex-partners, but also our intensive case management approach around those who abuse family members. So we're the only borough in the country that has dual accreditation for those two strands of work. The behaviour change program is 26 weeks in duration. It can be offered to anybody who is abusing their or has abused their partner or ex-partner or family member. And again, we can be really flexible. We do it on a group work basis for heterosexual men, and we can do it on an individual basis for everybody else who maybe wouldn't be, for whom the group wouldn't be suitable. So again, we help everybody, and we can also intervene with everybody to reduce harm through domestic abuse.
Thank you. Like if there's any follow-up questions to that, or if not, any other questions? This is in relation to holding power changes to account.
Yes. Having focused on how we can protect victims and survivors through a systemic approach, once a perpetrator has been charged, how does the BCU work with various other services, council and probation, prisons, to prevent further abuse happening to the victim following that charge? And do you have any examples of tangible steps, either in specific cases or generally?
So I think, oh, sorry, did you want to come in?
So I'm coming after you.
Sorry, it's only because we specifically said about the BCU, but I can dock into that. So I think, obviously, once the perpetrator's charged, there's various different systems we can dock into. So particularly if it's, something that would go to the MARAC, that's where we would then reference the sort of risk factors that we identify, and then sort of docking into all of those services that Carol's just explained. Additionally, we have for sort of sex offenders, the MAPA process, which is very, very similar, but obviously looking at either violent and sexual offenders, not obviously exclusively around VAULT, but particularly around sex offenders, likely to be a big cohort there, and the kind of ways in which we can signpost and sort of work together collaboratively as different agencies in terms of whatever the needs might be there. I think obviously once somebody's charged and then they go into the criminal justice system, it's very much obviously hands over to probation. I think in terms of that wider victim support, that's where those sort of additional services that, again, not repeating what Catherine said, but all of those additional services, those kind of more holistic services, can then continue to work with the family, the survivor and or the perpetrator. But I think very much from a statutory perspective, sort of into the criminal justice system, it's then into the probation territory. So, sort of from a policing perspective, it would kind of end there.
So, to me, hi everybody. So Stephanie Salmon, head of service for Hackney City Lady. So I think that if I just take one step back a little bit, I think especially in terms of the East BCU, so Hackney Town Complex, we have really good partner working relationships. We also noted that we had a particular gap. We noticed earlier, I think it was potentially about 18 months ago or so, where we noticed that actually I got real-time information about anything that happened in relation to gangs, anything that happened in relation to the people being jailed and picked up. But there was a gap in relation to domestic abuse incidents. So I now get an overnight record of people who are in the cells. So I'm able to use that information, check it across our system, whether or not it's Hackney-based, London-wide, and link the OICs in with the relevant people to pick up. So I just wanted to put that out there because I think that that's something that's quite unique that maybe is not happening in other parts of London. So it allows us to kind of take some quick action. In regards to what happens in the partnership, we are very much around the table. So we have designated single points of contact for domestic abuse across my unit. So there's, I think, 2 staff and a manager. So all of those direct, particular, difficult questions that people don't kind of understand how to particularly manage a case, they can direct them in that space. In terms of all of the MARACs, we're present and an active part of that, those working relationships and agencies. We build those risk management plans together. So when we're looking at resettlement, we are going to the partners around the table. We are saying, what do you know about the survivor? This is what we know about the perpetrator. How can we best risk manage? So we're using things like GPS trackers to maybe put particular exclusions around where we don't want perpetrators to go, because actually that we want the victim to feel safe in a space that they've identified. That's if a survivor or a victim has said yes, for instance, they were in a relationship together and they knew where they were. So in those situations, and where we have situations where we can't put some of those things in place, we work with our partners to say, okay, what's the best that we can do to address the issues that are around? So we are very much, we're in resettlement panels together. So when we're looking at someone coming into the community to ensure that the mental health, the drugs, and alcohol, police are around the table. So we're looking at everything as a holistic approach, as opposed to being
doing things in isolation because we cannot manage in isolation. We don't have the numbers, and we need the other people's expertise around the table. So we work quite closely in that space, and I've worked quite a lot around London, so I'm very pleased to be in Hackney with some of the partners I sit down, because we do, Yasmin mentioned earlier on, that we have those instant meetings for those things that really come up that are instantly high risk. And I can guarantee you, whether it's on a Friday afternoon, we are all around that table, and there are plenty of people there. We had one the other day, we had threats to life. We were all there, we got around the table, we were able to plan, risk manage, pull people in and ensure that that particular survivor was safe until we can move into a more wider risk management plan. I'm really sure it's not one agency in isolation. We are really trying to work together, and really trying to learn from some of the things that we've had previously, which was mentioned earlier in relation to domestic homicide and the sharing of information. We're really trying to work a lot harder to do that. In terms of the stats in the picture, we obviously have our own offending behaviour programmes that individuals would be subject to whilst they're statutory, but we obviously also encourage our practitioners to refer into the council service, because that's something they can do as they move on and they become non-statutory.
Thank you. Can I check if there are any other questions from members? One bit we've touched on a bit already, but it'd be useful. Sorry, I'm just looking at yeah, sorry. So historically, charge and prosecution rates for domestic abuse and sexual violence have been quite low, and which can be deterrent reporting and also I was just wondering if you could talk to how the criminal justice system is working together to try to improve investigation, detection, charging, prosecution rates, and sentencing outcomes. And I think in this time it might be, because the main reason we're here is about making recommendations, so it might be useful for particular kind of pinch points or challenges. That is also helpful for us to know, because part of this is also understanding what you have.
I'll just give a really high level overview, and I will just hand it over to Yasmin as well, just to give a bit more detail. But I think it's a whole systems approach. I think there's lots of things that I can do in my role to ensure that, like, my teams are doing as much as they possibly can in relation to, you know, obtaining the evidence, building a case file, ensuring that the case file is, you know, any actions are addressed to the CPS so that the file doesn't get discontinued at court. I think there's lots of different things. There's lots of different ways in which I can check and have those checks and balances to ensure that we are making sure that a case goes from reporting all the way through to a trial as smoothly as possible. There's definitely certainly locally, we've got a really, really good relationship, obviously with probation, which we've already talked about, but also with our deputy Crown prosecutor. So Yasmin's been really pioneering, actually, in terms of trying to enhance and increase the numbers of CPS referrals we're getting in relation to particularly domestic abuse, because we know that the earlier referral goes to the CPS, the more likely we are to get a charge, even when it is sort of evidence-led and perhaps victims on to wanting to sort of give evidence. So there's work there that's ongoing with the CPS, and I think there's much better and closer working with our CPS colleagues to ensure that any sort of issues with case file quality going through court is addressed quicker. And that is still a challenge. I'm not going to sort of dress it up in any other way, but it is a challenge, and it is certainly something I'm really, really focusing on. So in the interest of time, I'll quickly hand over to Yasmin, because I'm conscious of that.
So domestic abuse, we are up top in the Met and 12 numbers, Hackney's as well. You know, we're at 15.2%. Up to that point, and that's compared to 9.2 last year. So we've done really well there. Rate-wise, again, we're in the top three. We're at 15.2%, compared to 9.9 last year, and we've had a 2.8% decline in rape offences. We are doing a lot of pilots at CPS, Crown Prosecution Service. So we're part of the CPS Victim Transformation Programme, which starts next week, and CPS are now going to be contacting victims directly and letting them know why they're charging. offences as well, and give them that support from the BCU to court and further, which is really good. We work on a 2-week basis, meetings with CPS around action plans, escalations once cases have been charged, to make sure that we don't lose victims. And we're also with the Crown Court implementing, and this is a pilot in Central East, so in Berks Borough here, where they're going to be looking at the coercive controlling behaviour as part of domestic abuse, and looking at those files to go up within 30 days to get charging advice on that. So piloting that central. So it sounds good work, really.
Thank you.
If I just ask how many women drop out, like the attrition rate of people dropping out of the criminal justice system before it gets to court, if you got that for Hackney?
I can tell you, on a personal thing, what I know is that out of 100, you may get 2 or 3.
Because the Victims Commissioner report in July said that 40% of all victims drop out, and the figure rose to 59% for domestic abuse, and then 74% for rape.
Yes, Central East. No,
That was the
no,
victim of London.
no,
That's
we
London
wouldn't-
data.
No, we wouldn't fall Central East. We try very hard to get people through the system.
Yeah, because obviously this report is quite damning, saying that people
Yeah.
find it, you know, officers, you know, that don't treat them with respect. And I know it was looked over kind of 2 years, but it'd be good to understand
There's a lot
that.
of training around victims of domestic abuse and children. We go to response teams every 3 months on their parades.
But do you have that kind of data of how many drop out by before
No, we
court?
don't have the exact.
I think also there's also a baseline, so there'll be an X number, we'll never have had the victim engagement in the first place, so I suppose we'd then need to kind of work out thereon after what, because obviously we have like evidence-led prosecution, so where the victim doesn't want to.
Yeah, no, I'm talking
So-
more about attrition and people
Yeah.
leaving because they, haven't had the service that they kind of expected on reporting.
I think if it's sort of post-charge, that is CPS data, so it would depend on whether or not it's still evidentially sound to take to court, or whether it would mean, so there would be data around if, for example, the victim decided that they didn't want to give evidence, and that meant that the prosecution essentially collapsed. There is data that would say the trial wasn't progressed because
I guess I'm talking more about women who report and then kind of don't get phone calls or are treated disrespectfully. I mean, have you looked at this the victim commissioner report that came out?
Not specifically when you're talking about now, but I think I suppose if we're saying it's because of these very specific reasons, I don't think we wouldn't specifically document that, not at that local level, but certainly if there's reasons for victims evidentially pull out for any reason, that data would be available within the CPS.
And then would you look at that then in terms of the way that you improve your service?
Yeah, so one of our key things is at the moment, particularly around victim care, I mean across all crime types, is actually ensuring that we are engaging with victims and getting their update. Really basic stuff that we should be getting right, a lot earlier and doing a lot better on. Engaging with them, giving them updates and trying to keep them engaged in the process. I think, as we all know, and more broadly, the criminal justice system can really elongate something. And I think that in itself is also a challenge, something which I can't overcome. But what I can do, along with obviously what Yasmin's saying, is ensure that actually our victim care locally is better and is improved. Because at the moment, it isn't where I want it to be. Ultimately, for war victims, for domestic abuse victims, for any victims. And I have introduced it. Yeah, I mean, I'm trying to just even have basically any officer on the BCU, there's a chance that their crime now could have a quality callback from any one of my SLT, and we're implementing that, and talking about it every Monday morning in SLT to identify other challenges that arise from that, but also what was the victim.
So you call them back, call them back and say how did it go?
Yeah, really basic stuff, but also actually it puts people on notice, because if I think my BCU commander might be ringing my victim, seeing how polite I was, it might make me behave, in a slightly more professional manner or whatever. Just little things like that. So it is, I'm not going to dress it up. There's definitely, challenges and we can do better. And I'm really trying to sort of push that. But I think the very specific data that you're asking for, I will see if I can get
Yeah,
it.
that'd be good to see.
But as I say, it might be I have to get some of it from CPS.
Thank you. That sounds good.
A quick review.
Very good. Just on that follow-up that you do, what does that cover? What kind of questions do you ask? What information are you looking for from your officers?
Well, there's so at the moment there's the victims' rights. So there's 7 rights which we've determined that we're going to be measured on. So wanting to ensure that victims are getting regular updates, that they are getting notifications around arrest, charge, any sort of substantive change or progress in their case. But also just kind of that softer skills. How polite was the officer? How quickly did they turn up? How did you feel listened to? And some of it is also procedural based, sort of almost trying to map what the victim is saying on the phone to us as in what they'd said that happened versus what we can see that's written on the crime report, and actually just trying to ensure that there's an accurate record of what we've been told. And actually we've gone back to METCC and done some callbacks where victims told us one thing and the crime report said something else. And we're saying, well, these 2 things don't marry up. So let's actually hear what the victim said when they rang the police in the first instance. That wasn't a mortgage, that was a theft snatch actually of a mobile phone. But so all those 7 victims' rights, making sure that all of our sort of obligations towards victims are being upheld. But as I say, more of that kind of, I suppose you determine it in sort of other worlds, like kind of just general customer service, like how was that interaction with that police officer and how would you grade that quality of encounter from both the reporting officer and also, any subsequent investigating officer.
Thank you. I'm just going to bring us on to our progress. You're almost.
No, it's fine.
But it's building trust and confidence, and can I check if members have questions that they'd like to come in on.
Yeah, I'm just gonna, I'll just ask one quickly, so this kind of links to the conversations we're having around migrant women as well, but just, ensuring that people have that confidence in the service that they're going to receive from the police. So I guess it's just in light of, like the Casey review, the Angelini report, like what are you doing locally to make sure you're assessing and addressing things like misogyny, making sure that women feel safe reporting to the police?
Well, I think more broadly across the Met, there's been a big investment in trainings. We had our new Met for London training that's just the first wave is coming to an end. There's lots and lots of training, but I think also it is incumbent on me and also my colleagues to ensure that actually the training is then being adhered to and there's those checks and balances. I think a lot of it is around culture, but also, again, not sort of keep banging the drum around these sort of victim callbacks, because that really isn't just the only solution, but just also just seeing actually how victims do feel seen and heard when they're reporting something, and being able to address that directly with that officer and the line manager, but just kind of understanding what that sort of culture looks like. I think there's lots of lots of different things that we can do, but I think if we're talking about misogyny, obviously internally is in itself a big topic, but I think really just making sure that we've got that sort of professionalism amongst officers reporting, and obviously Yasmin's talked about talking to the response team, is making sure that they really understand the sort of the importance of that interaction. And I think the risk that actually if they don't interact in a fair way and make victims feel listened to, that the cascading domino effect that therefore has on their trust and confidence in A, reporting anymore, and and B, just generally in that case that they've reported. And I think the only thing we can do is just keep trying, keep talking, keep explaining, keep saying why, and then having those little safety net things, where we're docking in as well, just picking up, maybe either good practice, but also practice that we're also not satisfied with, and are just addressing that directly. And I think just really having that culture of saying, what, we are looking, we are listening.
It's encouraging internal reporting as well, isn't it?
Yeah.
To make sure, because that's what it's about. The culture inside affects how you behave outside. So, yeah.
And have you felt that the new Met for London training, have people had light bulb moments, or have people said, I felt like I knew some of this already, or do you feel like it has shifted? Things?
I think it has. I mean, I think you'll always get a varying degree of people's feedback on it. I mean, it's quite a lengthy course. It's 3 days. You know, even just from an instruction perspective, it's a challenge, right? So, but it is a big investment, and Commission's obviously, you know, really committed to it. But I think in any case, you know, it is really actively talking about these issues. And actually, I think the only other way that I can try and sort of further solidify some of this is actually making sure that, you know, it's not just always me, for example, that's sat here in these sort of forums. I think having this active challenge, officers having variety of exposure to it is really, really helpful. So they can sort of develop and understand their own, you know, different people's perspectives on policing. So I think that actually is really helpful for that sort of personal growth within, you know, within them. So, yeah, yeah, as I say, I think there's mixed reviews, but I mean, it's definitely helping. It's certainly giving them that kind of platform to understand things in a different light.
And it's very rank.
Yeah, yeah, it's even not, you've got to go on it as well. So.
And wave 1 is around public protection. It's around domestic abuse, rape, child abuse, child sexual exploitation. Yeah, thank you.
So I've taken us slightly over, so I'm going to draw questions to a close now. Just before I complete close the item, I just wanted to check in terms of the various representatives in the room, if there was anything that people hadn't had the chance to say that you were keen to make sure was captured. I'm not going to do more questions at this point. I'm sure we can do further follow-up questions. But yeah, I just want to thank everybody for taking the time to share your expertise and your insights this evening. I think it's an investment that heard from us is very much a multi-agency multi-partner approach to things that we have so many people around the table. And I'd like to thank, of course, for your time and your questions, but also all the work that is going on as we hear about tonight. After the meeting, we will reflect on the evidence we've heard tonight, along with the other evidence we've heard in things like focus groups. We might look at some further specific areas that come out maybe today, or again, the focus group for further exploration. And as a result of that, we'll be making recommendations for improvements and things to be done within the strategy that we heard earlier. It's due to be so yeah, we're going to draw that to a close now. People are welcome to stay, just like they're also very welcome to free. Thank you for the
Yeah.
Yeah, that was good. It was good. Just say to you, of course.
I think I'm coming. Such a big
I'll speak tomorrow. Yeah, I'm committed. Yeah, that's fine. Intro, everyone's welcome you there. Sorry, Janice. Yeah, let's go there for us.
Sorry, we still have some items before we need to go over, right? So item number 5, scrutiny reports, letters and responses. So we've now received a response from the executive to our findings and suggestions on supported accommodation, homeless residents, recommendations, and also on housing and green spaces. Can I check if members have had a chance to look at those, and if so, if there's any questions or comments that people have about the responses? Good. So just to note that for the supported accommodation piece, we'll be following up on programme at around March 2026 meeting. So that'll be an opportunity to check in on that. And also for the housing green spaces, will most likely be timetables in the next fiscal year. So we will make sure you come back to check in on progress. Talking point item 6, if you could take scrutiny actions tracker. Which, as a reminder, is being for us to check where we're at in terms of the various actions from the previous meeting. Again, can I check if members have any questions or comments on the tracker?
Just obviously there's a lot of awaiting responses. Is there an update on when we might get them?
Yeah, so Craig. Craig, do you want to come in on the tracker?
Yeah, so the first 3 questions around the council housing building programme have been answered. I've received those this week, so I will forward those on to you all when I am back in the office. The last 3 I've chased a number of times, so hopefully they get through to us as soon as possible.
Thank you.
Right, and just to say again, I think that having the tracker is really helpful.
Yeah, really helpful.
Okay, item 7, living in Hackney work programme. Again, we must have that in front of them. Sorry,
Just, I think the date of this meeting needs updating on that. It's not on that day.
Thank you for the spot. Is members have any other comments or questions on the work plan? Great. Item 8, minutes of meeting. So the draft minutes of the last meeting held on the 9th of July 2025 are in the agenda pack. I've had from members that are happy to note and agree minutes. Great. Okay, silences. Consideration. And then item number 9, any other business. Is there any other member either in person or online who would like to raise? For any other business?
Measures was they gave us very professional, excellent reports using the discrimination. They've been working on it for many years.
Yeah.
Especially federal legislation, chair of the organization, and she and I just met her. It was amazing, and I think we should get some their comments, recommendation. I'm sure our officers can do that. We need to keep us in touch with community and we can keep asking questions. They have all the grounds of information, not only Turkish speaking women and also some refugee Irish communities as well.
Craig, I don't know if you heard that, but that's just suggested as something that we might want to, if possible, follow up with IMJ in terms of their insight and thoughts for which might have any recommendations. Councillor Garbutt.
Can I just, sorry, I'm just going to go back to the work plan briefly. The at the bottom, it's got these things that we're going to receive quarterly and annually. The business critical performance dashboard. I just wondered when the first. I don't think we've had that before. Maybe it's not something unless I missed it. I don't know if Craig's got a comment on that, but when that will be, is it coming next time? When's the first report of that business critical performance dashboard?
Yeah, I can come in here. So Scrutiny panel are receiving the first iteration of that at its next meeting in October. That will be sent around to commission members, and then following that, it will be each quarter. In any case, the performance management webpage will be available to you all to check whenever you please. I think there's going to be some comms around that. from the corporate performance team. But I will also send that to you quarterly and make sure you have regular access to it.
Great, sounds good. And then we'll get to kind of, yeah, we'll have a discussion on it at the meeting it comes to, presumably, yeah. Great.
Yeah.
Councillor Joseph, did you have a question?
Oh, thank you, Chair. Yeah, apologies. For some reason, I can't raise my hand anymore. It was just on the responses to our recommendations around supported housing. I just wondered if we would be providing any written response back. I mean, I know it could obviously bounce back and forth, but I just felt that some of the responses were a bit vague, and yeah, it would be good to get a little bit more detail around some of the responses, really. Bit disappointing, some of them.
Brave, I'll slightly differ, but I assume there is an option if there's things where we might have a follow-up question or things where we wanted to tie things down a bit more, then we can send a follow-up on that. Is that right?
Yeah, absolutely. So we're planning on bringing officers and the cabinet members in for formal scrutiny at the March meeting.
I see.
On those recommendations, but absolutely, if you have any questions in the meantime, I can send those across to them and get some answers to you.
Okay, then. Thanks very much, Craig. I'll jot them down, but it's good to know they're coming back. Thanks.
Great. And yeah, so Councillor, if you had specific things you wanted to follow up, and if you could pop that in an email to Councillor Anjari and Craig, that would be really useful, I think. Any other business? In that case, thank you very much. For your time and questions.
Thank you.